All right, good morning, everybody. Thank you all for coming out today. Happy springtime. I think you know from the very beginning of my administration, we've been committed to making Louisville a healthier city, a city of lifelong learning, and an even more compassionate city. It's timely because we're in the middle of Give a Day week right now, and people all across our city are volunteering and performing acts of compassion. We're heading over to the big We Day event. There's 4,000 compassionate kids at the Kentucky Center this morning. So when you think about these values of service and health and learning, they really all come together in our Healthy Start program. Our Healthy Start program is coordinated through our Department of Public Health and Wellness. The Healthy Start promotes safe pregnancies by visiting the homes of pregnant women both before and after the birth of a child to help make sure the moms have access to prenatal care and keep all their prenatal appointments and the newborns reach developmental milestones. These, as we all know, are essential steps for children in terms of both physical development and brain development so they can stay on pace to enter kindergarten ready to learn. Because the unfortunate reality is our least resourced kids are 3 years behind our most advantaged kids. So the work that Healthy Start does makes sure that those gaps do not exist. There's other family support services as well. They include help with the WIC nutritional program, parenting classes for moms and for dads, childhood immunizations, physical and mental health screenings as well. So Healthy Start works to reduce infant mortality, the rate at which babies die before their first birthday, and to improve the health of newborns in 5 West Louisville zip codes where the infant mortality rate is more than double the overall rate in Louisville. Obviously, that type of disparity is acceptable, and the zip code where a baby is born should not determine how long he or she will live a nice, healthy life. And that's why Healthy Start is so important. The results speak for themselves. Among participants in the Healthy Start program from 2003 to 2015, the average infant mortality rate was 1.13 per 100,000. That's less than 25% of the city's overall average and less than 1/10 of the average in the targeted neighborhood. So Healthy Start has a huge impact on our kids. That's why I'm excited to announce this morning that the United States Health Resources and Human Services Administration has awarded our Department of Public Health and Wellness a $4.6 million 5-year grant to continue the outstanding work of Healthy Start. Those shouts are well-deserved. Think about all those healthy babies and healthy moms coming from this grant. It's outstanding. So we're really looking forward to offering this service to more families and helping them get the resources they need so their kids can grow up healthy and strong and ready to learn with big smiles on their face. That's not only what a compassionate city does, it's what a smart city does as well, so that everybody can reach their full human potential. I want to thank our great Congressman, John Yarmouth, for his role in securing the federal funding and for his continued work on behalf of the children of Louisville and their families. I want to recognize Whitney. I saw her earlier from Senator Paul's office. Thank you for being here and your help. And when you think about these grants and when you think about where we're at with our city right now with our budget, we're dealing with an enormous budget shortfall driven largely by state pension obligation and council inaction to address that. We're going to continue to have budget problems. So partnerships like this and grants like this are incredibly important for us. I'm working now on my budget proposal for the fiscal year that starts July 1, and given that the pension bill and the council's rejection of a plan for new revenue, it's going to be tight, and this could not be coming along at a better time. I can tell you that my team and I are trying to lessen the impact on our city's most vulnerable with this proposed budget coming up. So I'm especially grateful for grants like this, and I'm especially grateful for tremendous partners like Congressman John Yarmouth. Congressman, share some good news with us.
Well, thank you, Mayor Fisher and everyone here today for being a part of this wonderful announcement. Today is a great day for our city, for its families, and for our future. This Healthy Start investment and the programs it will support have the power to change the trajectory of the lives of Louisville's children. Healthy Start means just that, the healthy start of a pregnancy for soon-to-be mothers, the healthy start of the life of their newborn child, and a healthy start of the potential of a growing family in West Louisville. This isn't just routine funding that every American city gets. You have to work for it. You have to plan and execute. You have to prove your ability to administer success and show your results. And that's exactly what our city has done over the years since Louisville Health Start got its start in 1998. The grant we're announcing here today is only awarded to a total of 100 Healthy Start initiatives across the country. And Louisville's name being included in that list is a testament to the work being done locally by those on the front lines, some of us behind us here, who are working to make a difference in the lives of West Louisville families. Each year, as appropriations season ramps up in Congress, which is the process that funds our discretionary federal programs, there's a core group of initiatives that I take the lead on. Healthy Start has been chief among them for as long as I can remember. Working alongside my colleague, Congresswoman Glenn Moore of Wisconsin, and that's in large part because I know of the potential of our city to continue to make the most of these dollars. I'm so excited to be a part of today's announcement, to be among these families and providers and see firsthand the living, breathing proof of the life-changing work being done here in our community. Thank you for allowing me to be your congressman. Thank you, Mayor Fisher, for being America's best mayor. Thank you, Dr. Lori Kaloya, for continuing to make Louisville a national model of success, and thank all of you here today for always working together at the local, state, and federal level to do all you can to make Louisville the place we're proud to call home. Congratulations to Healthy Start, and I look forward to more years of wonderful progress for our community.
Thank you, Congressman. We're now going to be hearing from Dr. Lori Kaloya. She's the medical director of the Department of Public Health and Wellness, an outstanding member of the team. Another outstanding member of our team, Dr. Sarah Moyer, she's our public health director and chief health strategist for the city, could not be here because she is away on maternity leave after giving birth to a healthy baby daughter, Rosalind, on March 22nd, and I'm happy to report that mom and baby are both doing very well, so we wish them the best. Dr. Kaloya has been doing a tremendous job as medical director. She came on board in November of 2017, and the very next day, the state declared a hepatitis A outbreak. So you had your hands full. And while the hepatitis A outbreak in Kentucky went on to become the nation's worst outbreak, here in Louisville, the Center for Disease Control called our response the gold standard for the country. So we're really proud of our Department of Public Health and Wellness, how you all mobilized in such an effective way against Hep A. So I really appreciate you and your team for doing that. It gives our city great confidence in our metro government and what you all do. So let's now hear from Dr. Kaloya. Lori?
Thanks, Mayor Fisher, for your kind words. And thanks to Congressman Yarmouth for your work in helping to secure this grant. We're deeply grateful to be one of only 100 cities to receive this funding. We know that the future prosperity of any society depends on the ability to foster the health and well-being of the next generation. We also know that when a society invests wisely in children and families, the next generation will pay that back through a lifetime of productivity and engagement. These resources will allow us to continue reaching out to the next generation in some of our most vulnerable neighborhoods. Our Healthy Start program is instilling hope and improving the lives of babies and their moms and dads in West Louisville. And in the West Louisville neighborhoods where opportunities are not as abundant as they might be in other parts of our city. And another one of our initiatives, Healthy Babies Louisville, which comprises 17 of our city's top health and human services agencies, is working across multiple sectors to make the systems changes that are necessary to level the playing fields for infants and their families. I want to thank our hardworking Healthy Start staff, including our nurses, our outreach workers, our peer advisors, for the hard work you do every day on behalf of Healthy Start families. I also want to thank I also want to thank our community partners, including Norton Healthcare, Family Health Centers, Mama to Mama, Dr. Armand Perry with the University of Louisville Kent School of Social Work, and the March of Dimes. As the mayor said, our mission is to build a city where everyone and every community thrives. We want to build a city where everyone has the best possible chance to reach their full potential for a healthy and productive life, no matter what neighborhood you live in and no matter what zip code you're born into. We want to achieve health equity in our city. This grant allows us to continue the work as we strive toward that goal. And now let me invite up Regina Moore, our Healthy Start Community Coordinator, who will introduce us to a Healthy Start family. Thanks, Regina.
Thank you, Dr. Kaloya. My name is Regina Moore, and I am the Community Outreach Coordinator for Healthy Start, and I'm honored to say that I've been with Healthy Start since 1998. So I'm going to introduce one of our Healthy Start parents. This is her second child with Healthy Start, and I'm going to kind of put her on the spot. Tony, you want to come up? I just want to ask you a couple questions, if you don't mind. Can you tell us what Healthy Start has meant to you and your family, the benefits that you have received from Healthy Start, and just give us a brief synopsis?
I would say my husband, the education part of it, he never really was around children or pregnancy, so he had no idea. He was excited but running around like a chicken with his head cut off. And then for myself, I felt pretty knowledgeable. I was kind of too cocky, I think, with my first kid. I'm a nurse, I can do this, I know everything, but I had postpartum depression, and Healthy Start arranged and did not let me make any excuses for getting in-home therapy, and that made a huge difference with my first child, and then the healing that went into having a second child after that.
That's awesome. One more thing. If you could say anything to the community about Healthy Start, what's that one thing that you might tell the community?
Do it, get involved, because it makes a difference, and you do not know what you do not know until you get into it, and you have no idea what kind of impact it can make on your life until you do it.
That's awesome. Thank you. Thank you. I just want to say one more thing. She's absolutely right. When she mentioned her husband, what I didn't say is, although I coordinate our outreach activities for Healthy Start, I also coordinate our fatherhood initiative, 502 Fathers, fatherhood initiative. So we do incorporate the entire family into Healthy Start, because fathers do make a difference. And Dr. Kaloya mentioned Dr. Armand Perry. He's very instrumental in that also. He evaluates our program, and he does an excellent job. Our program is doing very well in that area. And I don't know who I'm supposed to give this over to next, but Mayor Fisher.
All right, let's hear it for Regina and the team. Now, for moms out there that are thinking about this, you should see an additional benefit. If you're part of the Healthy Start program, your children will behave perfectly, like these guys up here will. They'll sleep on demand, they'll wake on demand, they'll be quiet on demand. So it's an incredible output we have here with Healthy Start. So we're so excited about this grant, all the good work that allows us to continue to do in our community so we can keep our great city's momentum going. So thanks, everybody, for coming out today.